Here, let's see. Sorry about that. Okay. Okay. Alina is saying, I believe that they are invisible and are ignorant. They feel it's obviously can't happen to them. Okay. But at the end, it's better safe than sorry. I agree with that. Absolutely. And then Marine had said, okay, let's see. I have one more comment here. I want to make sure I read some of the comments too. Let's see. Yes, Marine had said it's kind of like a civil duty on our personal level to make sure we are safe and others around us are not harmed because of us, as anyone could be a transmitter. Absolutely.
That's absolutely right.
Yeah, that is the right mentality to have right now, you know. Even in the beginning, I liked how the medical professional on CNN were saying everybody should act like they have it and just be cautious on that level. I wanted to tune in to shift gears a little bit and talk about, you were telling me about the what you're seeing in younger kids, some of the symptoms in the in younger kids. Could you speak on that?
Yeah, so COVID-19 itself, or coronavirus itself in kids, that is not manifesting as severe illness as it does in adults. And some of the kids have very mild symptoms like cough or cold, or some of the kids have no symptoms and they're actively transmitting it. But what is coming into light recently is called the pediatric multi-system inflammatory syndrome. So that is like a result of having had COVID infection in the past couple of weeks. So it's not a direct manifestation of the infection, but it's how your immune system or their immune system is reacting to having had the virus in the previous couple of weeks. So it's a whole set of syndromes or features that they have been noticed to be presenting with. So some of the symptoms are very similar to another pediatric illness that we see quite commonly called Kawasaki syndrome. So the kids that are coming in, they're having fever, they're having prolonged fever. So fever is not going away. It's been 4 or 5 days and they're having fever. Then they can have unusual rashes all over their body. Typically in Kawasaki's, you get swelling of your lips. Your tongue can become very bright red, like a strawberry tongue. You can have lesions around your mouth. Your hands and feet can swell up and be red with rashes over there. And in the little kids, they can have the rash in their diaper area.
That sounds really painful.
I mean, these are a manifestation of symptoms that are being noticed, and all of this is a result of how their immune system themselves is reacting to having had the virus in their system. And then there are a couple of other things. The most significant thing about it is its effect on the heart. So with Kawasaki's, or even with this, what happens is the blood vessels of your heart, the arteries which supply your heart, they can become dilated or bigger in size, like an aneurysm. So there's a chance that can at some point rupture if it's not treated in time. So with Kawasaki's itself, we usually like to treat them within the first 10 days to know that the effect of it on the heart will be altered based on them being treated. So that's what we've been following guidelines for this new pediatric multi-inflammatory syndrome too. The other part of this inflammatory syndrome associated with the coronavirus that we're seeing in kids that we don't see in Kawasaki's is they are coming in with signs of shock. So septic shock. So their blood pressure is uncontrollable. So it needs medications to actually control it. To control their blood pressure. So they're having so low blood pressure that you need to give a medication to control it. And their heart rate. Their heart is not able to pump blood to the rest of the body. So you have to give medications, which we call inotrope medications, to help the heart muscle function and be able to pump the blood. So these kids are getting sepsis or septic-like syndrome symptoms along with the Kawasaki-like symptoms.
So these are very scary symptoms. Over here, BN4, she's saying that her sister-in-law was mentioning that, and it sounds really scary. It is definitely very scary. Alina is saying, as a cancer patient myself, I'm scared to even go to the groceries. Yes, I understand that for sure. These are a side series of symptoms or things that can come along after a child has gone through COVID? Is that what you're saying?
Yeah, so it's not during active infection. So it's the children that have manifested with this are kids who they tested and they found out that they had positive antibodies to COVID, meaning that in the past 2 or 3 weeks, maybe they had the infection and they didn't have symptoms from coronavirus itself, but now their body is reacting to the virus protein and it's attacking their immune system, and this is why they're behaving like this. But it does sound scary, I will tell you that, but just to reassure people, we can manage Kawasaki syndrome with medications easily and control that. And also in kids, when they present with septic like symptoms, the medications to control the blood pressure and the heart rate are pretty good, and children are very resilient when they come in shock, so they're very quick to bounce back. So the fatality from this syndrome itself isn't that high, the fatality rate. But yes, when you listen to the whole manifestations, I can understand that for a person maybe who does not deal with this on a daily basis, it may sound very scary.
Especially as a parent, and we were almost not to blame anybody because this is a very new virus and nobody knows about it. But in the beginning, we were like, okay, this is a virus that affects the elderly. The younger ones are going to be fine, the young people. But now it's more and more coming out that it's affecting every population, and socioeconomic status, race, all of these factors have no effect on who's going to get the virus and who's not. Perhaps the only thing is lifestyle measures and lifestyle choices that you're making.
Yeah, and a lot of that also, Bushra, has to do with, because with time, we're also learning about this virus with time, and we're seeing its manifestations every single day. So maybe if something wasn't known about it on day 1, maybe on day 35 you know something more. And secondly, it's a virus, so viruses usually go through mutations with time.
I see.
So sometimes their manifestation, the way they're manifesting, can change based on how it's mutating and changing its structure.
That was actually going to be my next question, not in a doctor's terminology, but I was going to ask you, has the virus evolved itself into other forms?
It has.
So that's what you meant by the mutation.
Yeah, they are talking that it has mutated. As far as I know, I think the last time I heard, there have been a total of 12 mutations so far.
What does that mean, Masna?
That means it does little changes to its protein structure. And when there's a change to the virus structure, the way it will affect a person might change a little.
Now, how challenging is that making situation for healthcare providers?
That is challenging, because then that's how you start seeing new manifestations which you didn't expect or you didn't discover before. So that is a little challenging. But I mean, that's science. That's what we're learning on a daily basis.
Right. Okay, let's look at some questions. There are some people going back to work. Hello, Jay. Hello, Ehsan is saying, how do we deal with skin allergies, like with excessive use of soap and sanitizers? That's a good question. Do you want to take that?
For skin allergies, I would just recommend that you do your daily, whatever routine you follow for your allergies, just continue doing that. And if a sanitizer is too harsh on your skin because they have alcohol in it and 70% alcohol, and that can be drying, then just try to use soap and water as much as possible, and only use sanitizer when absolutely necessary, so you don't have soap and water available. And actually, soap and water is much, much more effective, much more better in cleaning your hands and taking the virus off of your body than the sanitizer is. So okay. I would just recommend that they do that. They moisturize themselves a lot and use a emollient-based moisturizer, so something thick and sticky, like your like over here we have Aquaphor, or just the regular Vaseline petroleum jelly stuff, which will stay coated on the skin and keep it a little bit better hydrated.
Yeah, so I hope that answers your question. अगर आपको allergies हो रही हैं skin पे, तो आप you can use soap and water instead of using the sanitizer, because sanitizer में alcohol होता है. Alcohol is present in sanitizers. So just use warm water and soap, and just wash your hands and use a moisturizer, as doctor is saying. I have another question here. Does that mean if the vaccination, when created, would it work that effectively? Would or would it not work effectively due to the mutation, she's asking, I believe?
So I'm going to go to the example of the flu vaccine. So every year, a new flu vaccine is formulated based on research in their best estimate of that season of how much they think that virus will mutate. And that is the reason why when you do influenza vaccination, it's not 100% effective. So most of the vaccines are not 100% effective. But if you have a vaccine which affects a good percentage of people, so let's say 70% effective or more. But the key is that more people are getting vaccinated. That's causing herd immunity and it's protecting the whole community. But if you have a vaccine and only a handful of people choose to get vaccinated and the rest are not vaccinated, that affects the effectivity of your vaccine because there are so many people out there who can still contaminate you or contagion you.
Okay, that's a great point. So when the vaccination comes out, it will be more beneficial if more and more people do get it. Okay. Jay is saying, don't panic, guys. Eat good food. Don't stress and sleep well. Keep it simple. Okay. Thank you, Jay, for your tip. And it is true. You know, we have to lower the stress levels. We have to sleep well. We have to eat well to develop our immune system. Those are good tips, absolutely. But this is a real thing. My biggest concern was, what do you think, Mazna? Dr. Mazda, what do you think that now that we have this social problem that has erupted, which is I can't talk about it right now. It is a separate show. This generational of oppression and discrimination that is embedded in our society and has caused this big flare up all over the world, as a matter of fact. So what do you think? How will these protests affect COVID patients?
When I see the images of the protesters, Bushra, I feel very scared because what's going on in my mind is what's going to happen in the next 3 weeks. There are protesters who are being careful about it and mindful, and they are wearing masks. But it's really difficult to maintain a physical distance in a protest, in the large number of protests that we're seeing. But at least some are wearing masks. But there's a huge number who are not wearing masks. So my biggest fear is in the next 2-3 weeks, are we going to start seeing a big surge in patients as a result of all these people who are in that environment where for hours they are close to each other, and of course they don't have access to soap and water, so I don't know how frequently they're washing their hands. They're touching their face, eyes, nose, mouth. So
yes, it is really concerning. I know that this is required at this time, but I'm also very concerned about how this is going to affect and what the outcome is going to be. May God protect them and all of us, Another question I had for you is, what are your thoughts on herd immunity, and can you tell us a little bit about it?
So herd immunity basically means that a large population has to be affected by that particular pathogen, or maybe given a vaccine to prevent everyone else. So your classic example of herd immunity is the measles vaccine. So once there was no vaccine, measles was one of the most deadliest illness and most contagious viruses. But once the vaccine got introduced and majority of the population, especially here in USA, because it is mandatory in your childhood immunization schedule, everyone started getting vaccinated. The disease is gone. You don't see cases of measles. You do sometimes in the season may see a little bit spiking here and there, but that's only in the US at least. That's only as a result of travelers who are coming here from different parts of the world where they probably didn't have mandatory vaccination, so they're bringing the virus here. But again, you don't see it flare up or surge or spread in the community anymore because everyone has been vaccinated. Everybody has the protective antibodies in their system. So even if the virus is around, which it still is, the measles virus is still here, we never get sick from it because majority of the people here have the protective antibodies in us as a result of either having been exposed to it years way back when it happened or getting vaccinated from it right now.
Okay. So do you think this kind of concept, they've been talking in the third world countries and the progressive countries, they've been talking about herd immunity. Do you think this is something that might be effective in those countries?
I mean, at the end of the day, yes, it can be effective, but it will be effective after a huge price, and that will be after a loss of lots and lots of lives at the cost of that. And for herd immunity, you have to have, for this virus, they're saying you have to have at least more than 70% of the population being infected with the virus. So when they looked at USA, the number of people infected was like even way less than 10% or something the last time I looked at those numbers. And with that 10%, our numbers, our death rate is still so high. So imagine if we have 70% of our population infected, what will our death rate go from what it is right now? So that's a huge price.
That's a huge price. The mind cannot even accept that, and the repercussion that's comes along with it, the social repercussions, the mental, the emotional, all the pressure on the healthcare system, how societies are going to respond to that economically, financially, in many different ways. So it's a huge liability, I think. Yeah. I have a few questions for you. Do you think, well, I mean, this is more of a protest question. Like, do you think, is there a safe way to protest right now? Because the protest is going on in Europe, in America.
Safest way to protest would be that everybody in the protest just wear a mask.
Wear a mask, yeah. And the mask is also not 100%, is it? Marine is also saying the mask is not 100%.
Yeah, it's not 100%. Nothing is 100% at this point, but it's a good percentage enough to decrease a huge number of infections. So, and the thing with the mask is if everyone is wearing a mask, chances of transmitting the virus from one human host to another is considerably decreased, as opposed to if 50% are wearing the mask and 50 are not.
Okay, yeah, so it's just trying to decrease the probability of getting it by following, again, the basic protocols.
Because you have to remember the virus itself isn't alive. It's a particle. It's a protein particle, an RNA particle. It isn't alive, and the only way it can stay alive is by jumping into a host. So once it's in a host, then it becomes alive. So that host can give it to the other host, but if it can't go from one host to the other, once it's done with that host, it has no life of its own. It's not a live particle.
Okay. So if it's not, then I want to ask you a question that just came into my mind. So if it's not alive, it's just a particle. So why are the bodies not being given to families, and why are we having no funerals? Why is that not allowed? Because I thought bodies were infected.
Right. So because there's not great information or data as of right now that if a person has had that infection and they've died with it, how long are they contagious, or their body tissues or their saliva, because you will come in contact, someone may come in contact with that. How long is it viable on that person? And as far as funerals are concerned, that just has to do with the mass. So
the number of people.
Right. So a couple of people, immediate family members at a funeral, wearing masks, keeping distance would be fine, as opposed to having like a whole community attending a funeral.
That makes a lot of sense. So today we have covered a lot of things. We've talked about what does it mean going back to work? How can you stay safe at work? How can we modify and continue following the protocols? How can we stay safe and make sure that other people are safe too? We have also talked about that the virus is pretty much present still. Nothing has changed. We don't have a vaccination for it. We've talked about the pediatric symptoms that might be coming with it. You've covered a lot of different topics today. I want to know, like, what do you think, as a doctor and as an educated person, as a part of society, what is it going to mean to move forward with COVID-19? Because as of right now, we don't have a vaccine.
I mean, again, it's just going to be that we will have to come to terms and accept the reality that life has been reset for all of us at this point until we have something final that we can take care of it, or maybe hopefully the virus itself loses its virulence and just goes away by itself, like wishful thinking. But we will have to live a little differently until things can be fixed. Because if we want to protect our loved ones, because anyone's loved one can be affected, we have to be mindful of everybody. We don't want it spreads very rapidly from person to person. A lot of people may think that they're perfectly fine, but they may actively be transmitting the virus to other people. So every individual needs to think that it's not about themselves, it's about everyone in general, and that way they can protect everyone and just try to learn and live the new normal that we have to.
Learn the new normal. Absolutely. Keeping your environment clean, keeping your hands clean, cleaning surfaces, keeping your mask on. And I'll tell you, it's becoming a little challenging now that we are in summertime, wearing the mask. Now I feel the pain of like doctors and surgeons. I mean, they have to constantly, that is your normal, right? Washing your hands constantly, putting the mask on, putting the scrubs on. That's your normal, right?
Yeah, so even before COVID, I mean, we always have before patient, after patient, you're washing your hands, you're scrubbing your hands, and now wearing the mask all day long in the hospital, especially because I'm wearing an N95 mask as opposed to simple, which is very tightly fitting. It's something, it's not easy to breathe in it either. So from 8 a.m. till 4 p.m., I'm in that mask. You're running around the hospital. Sometimes it gets hard to breathe in it. And then when you take it off, you have like, your face is indented with the mask. You can see where the mask was.
Yeah. That's difficult, and I'm feeling that because abhi yahan pe the temperature has gone up, and I was doing my regular run and walking and exercising, and I started developing some kind of rash on my face because I think of the heat and the humidity. So now a lot of people have the cloth mask, but some of us have the surgical mask, like the paper ones. I have been I've been just ironing mine and using them over again just to make sure that I kill the germs, or just putting them in the dryer. So do you think a cloth mask might be a better option? Because it's more breathable?
It could be more breathable. I mean, surgical masks themselves aren't that tight fitting either, and that's why they're a little loose around your nose and your mouth. So they're breathable too. Both of them are fine. The only downside I would say with the surgical mask is it's not easily reusable. I mean, it's not recommended to reuse. The reason we have to reuse it is because there's a shortage. But the recommendation is not to reuse it. But with a cloth mask, you can easily wash it, dry it up, and reuse it on a daily basis. So that would be one advantage, I would say. And with the cloth might be a little bit more comfortable on your face, especially people who have sensitive skin and can be having rashes.
Yeah. Marine is saying don't do cardio and wear a mask. Is there any relevance, any danger with that? Marine, can you explain?
So I think what she's trying to say is that, yes, if you're doing a high intensity exercise and you have a really tightly fit mask on your face, then there can be an issue with you getting enough oxygen to your body, and you can have a little bit of suffocation or difficulty breathing. So yes, and then another thing I would like to say is, so like you mentioned, if you are going out on a walk or a run, you're in an outdoor open place and you're the only person, or maybe there are 2 or 3 other people there and they're very far away from you, then it's very low risk at that point for you to catch the virus or give it to somebody, because there's nobody around, first of all, and the ones that are around are like way far away and it's very nice and breezy. So if you choose to, if you're having issues with the mask and you want to remove your mask just for that time, you can. And if somebody's coming, what I do is, if I'm outdoors, if I'm walking and if somebody's coming close by to me, then I'll put the mask back on my face. And then when I know I'm in an open place and nobody's around and I'm feeling uncomfortable, I'll remove the mask for a little bit.
Right. I've been wearing a loosely fitting mask, of course, and sometimes it's just becoming hard to breathe because it's getting warmer now. And you're doing cardio, so it makes sense that the oxygen levels can be affected by it. But let me tell you, there are so many people out there right now on trails, and they're not wearing masks, so it makes me a little nervous. Let's just look at a few questions, and then we'll do a summary. Aspen is saying, my husband got a rash and a little scar on his nose due to the mask. And BNB4 is saying, speaking of masks, what is the best way to dispose a contaminated mask? Okay, those are both good concerns. Could you speak on that?
if she's talking about a contaminated cloth mask, I don't think that needs to be disposed. It can just be washed and cleaned and reused. But if she's talking about a disposable mask, like a surgical mask, you can throw that in the trash. That's fine. It should be okay. Once it's been outside in the air for a good couple of hours, there should not be any viral activity on it.
Okay. Aspen was saying her husband actually got a mark on his nose because of the mask. Well, those are new scars that we're going to be showing off. And I think sometimes if you use some certain creams given by the dermatologist, they can go away the marks. Alina's saying, does this virus linger in air? And if so, how long do you it's present? Is it present? I think she means.
So for general people, if she's talking about like a general person, it may linger on in the air for a couple of hours, but then it has to do with how close you are to that individual in terms of distance. So are you within a 6-foot distance or are you far away from them? And then for how long are you in that close proximity to the person? So if you've been there for more than 30 minutes and you're with another person and the virus is in the air and it's not like a free breeze or air is moving and mobilizing, then yes, the chances of you contracting that virus would be higher. But if you're in a wide open space, you're at greater than 6 foot away from a person, and even if they are dispersing the live virus in the air and the wind is blowing it away, then your chances minimize much more. It definitely changes in healthcare settings because when we're in a patient room, it's a closed room, and then that's different for us. But just for the general public, that's the general rule.
So I